Hello. Today we'll be covering teeth care. Your body's so amazing. So today I would like to broaden your horizons, enlighten your world, and have you look at your body as well as your teeth a little differently. Today's studies by most dentists state that we don't brush our teeth often enough and as long enough. So today we're just going to go over some recommendations as it relates to teeth care. Um, They recommend for you to brush your teeth at least 2 times a day at a minimum. Meaning you can brush them 3 or 4 or 5, 6 times, but at a minimum at least 2 times a day, and for 2 minutes long or more. And for some people, 2 minutes is a long time. So what I did, I brought the grandbabies an hourglass that has a little smile on it, and this is a 2-minute hourglass. From any one of those websites that you order things on, I'm sure you can find this. Probably costs like $1.50. But I gave it to all the grandbabies. I bought some in blue and some in pink. I even used this one myself just to make sure I'm still brushing my teeth long enough, which I'm sure I do. But like I reiterate, um, most dentists recommend for you to brush your teeth at a minimum, which you can brush more, twice a day. Most of the time it's in the morning and the evening, and for 2 minutes or longer for the length of time. Then there's also a question about flossing. A lot of times the dentist recommend for you to floss at least um, once a day. And one of the reasons I think they recommend at least at a minimum once a day is that because the plaque and bacteria that forms in your mouth, once you eat things that's going to transfer that into a cavity, it normally takes 24 hours for that to form into something you don't want in your mouth. So at least 24 hours. So if you floss at least once a day, that'll help alleviate that problem. For me, I floss every time I eat something, just to get the food out from between my teeth or around my gum line. So you can floss more, but I recommend, for me, I do it almost every time I eat something. Um, when you eat acidic foods, those are foods that's like sugar in it, like sodas and sugars. Um, that's when the bacteria reacts to those particular items even faster, which is still 24 hours, um, to form cavities. So after you finish eating that acidic foods, the germs and bacteria in your mouth, that's what makes what they call an acid. And that particular acid will rot through your tooth enamel. So the sugar itself, and combined with the bacteria and the plaque, when you finish eating that acidic foods, that's what turns into acid and it eats away your tooth enamel. So what can you do? The recommendation for his teeth care is just basically simple. To brush your teeth 2 times or more a day, morning and evening. Excuse me, that's my phone. Sorry about that. Normally I put the phone on vibrate. But so then they also recommend for you, like I said, to brush twice a day or more. And hopefully you will lose a fluoride-free toothpaste. Stay away from that fluoride in the toothpaste. That's going to cause problems, especially in kids. Recommend also to floss at every meal. If you can't get electric toothbrush, get electric toothbrush, because electric toothbrush, what it does, while you're going back and forth, is actually going up and down also. So it's giving you twice the motion that you're doing for brushing your teeth. Or they have the ones that while you're going back and forth, it goes around in a circle. So you're getting the extra cleaning. So yes, electric toothbrush does clean better than just doing the manual, using the manual toothbrush, or you brushing it yourself, but without having an electric toothbrush. Also, there are mouthwashes out there that can kill 99% of the germs in your mouth, and also keep the bacteria and plaque down. So you can also use those in between after you finish brushing your teeth and flush your mouth through with those chemicals. Um, with me and my family, we didn't eat a lot of sugars and sweets. So as you see it in my mouth, there's no fillings, there's no cavities, there's nothing. And I'm not tooting my own horn, toot toot. It's just that if you leave those sugars alone and just do natural brushing, you would definitely still cut down on the cavities, is basically what I'm showing you for as my teeth. and we never really ate a lot of sweets and sugars. And I guess I was lucky because if I was a kid now, I'd probably be tearing up some sweets and sugars. But because of that reason and just doing normal brushing and flossing, I don't have one filling in my mouth. I do have a problem. As you can see, these crooked teeth. I let my wisdom tooth come in the back, and it pushed all my bottom teeth forward. At the age I am now, I ain't even worrying about it. I can still smile when I have to. But this is tooth care and how to take care of your tooth and things they recommend. So as always, if you don't believe me, check it out for yourself. And I always encourage you to check it out for yourself. And if you do find out the things I'm saying to you is true, make a change. Make a change. So subscribe, like, share, and give me some comments. And as always, I'll see you on the other side.